Hi, welcome to Nclex Made Simple YouTube channel. Today we have prepared something special. You're going to learn about Nclex exam, and this is next generation Nclex, what you normally call NGN. Many people have gone to write the Nclex exam and yet they don't quite understand what it is all about. I'm also a victim because when I sat for the next generation Nclex, I didn't quite understand the case studies, and I only came to understand what is tested in the case studies later on after the exam. I wouldn't want any one of you to experience such. That is why today's topic is very important for anyone preparing for the Nclex exam. So stay with me and learn something. Today, as I have told you, the topic is what is on the next generation Nclex exam. What is on the NGN, next generation Nclex. Basically, we are going to be answering these three questions. What do the next generation Nclex question types look like? What does the next generation Nclex look like? What does this exam look like? And how is NGN scoring done? So when we answer those three questions, we will be done. So what is next generation Nclex? This test was launched on Fool's Day last year. Believe me, it was on Fool's Day, April 1st, 2023, to better measure nursing test takers, these new graduates, these novice nurses, entry level during the first year of their practice, to better measure their clinical judgment and decision making skills and abilities through the innovative item types. We are going to look at each one of them, those item types. What are they on the Nclex? Clinical judgment is important at the entry level. Every novice nurse within the first year of practicing nursing should demonstrate great clinical judgment skills. Research showed that newly licensed nurses are increasingly expected to make complex decisions while caring for the patients. We are living in times where patients are well informed and they demand better and safe care from nurses. So they are required to make complex decisions, and clinical judgment is what will help them accomplish that. The goal of the Nclex is to protect the public. Many times you have heard people say Nclex is all about safety. Nclex is a safety exam. This is what they mean. The purpose of the next generation Nclex is patient safety and public protection. That is very important. So as you sit for the Nclex, every question is demanding you to be safe. So you think about safety every time on the Nclex. Before the next generation Nclex, there was a research that was done, I think way back from 2012, and the literature review showed that 50% of novice nurses, we normally call them entry-level nurses, and these are generalist nurses within the first year of practice, the first 12 months, were involved in nursing errors. 50%. That is quite a huge number. And 65% of these errors were attributed to poor decision making. 65% is a huge number. Those errors were attributed to poor decision making. Now, this is it. 80% of employers were dissatisfied with decision making skills of these novice nurses, meaning only 20% were satisfied. That's now critical. So you can be able to see how clinical judgment is important, and that is why it is a very huge component of this next generation Nclex exam. The main part of the test is structured upon clinical judgment, and we can say 24% of what you will see on the Nclex is on clinical judgment. The remainder of the test is broken down into client needs categories, and the four main client needs categories are management of care and pharmacological and parenteral therapies, physiological adaptation, safety, and infection control. And you can see their contribution to the Nclex exam: 14% for management of care, pharmacological and parenteral therapies 12%, physiological adaptation 11%, safety and infection control 10%. And when you add to what clinical judgment has, that is 24%, you get above 70%. So that is very important as you revise as you prepare for this Nclex, that over 70% comes from these 5 top areas. These client needs categories are safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological adaptation. These 4 major client needs are further subdivided. So let us look at the way different items are distributed on the Nclex using these client needs categories. So safe and effective care environment, we said it is subdivided into 2. We have management of care and safety and infection control. Management of care could have 15 to 21%. Safety and infection control 10 to 16%. Then you have health promotion and maintenance, that is at 6 to 12%. Psychosocial integrity 6 to 12%, and physiological integrity, here we have 4 subcategories, and these are basic care and comfort 6 to 12%. The distribution of exam questions on Nclex. Pharmacological and parental therapies 13 to 19%. Reduction of risk potential 9 to 15%. Physiological adaptation 11 to 17%. So you can be able to see their distribution on the Nclex, and that is very important. As you prepare for the Nclex, just know what you expect. Next generation Nclex questions, question types. We have those we call standalone questions. These are like trends and bow ties, and we have case study questions. So let us look what is a standalone item. A standalone item or a standalone question has a stated diagnosis and an implied diagnosis. A standalone item has a stated diagnosis or an implied diagnosis. It includes clinical information for a specific client, and it provides components that require entry-level nurse to make one or more clinical decisions. So that is a standalone question. That is what you'll find on a standalone item, whether it is a trend, whether it is a bow tie type of a question. Then we have care studies. These are new items that have been introduced into the next generation exam. Care studies has clinical information for one or more patients. We have clinical information for one or more clients. A care study is a group of 6 items that represent the NCSBN clinical judgment measurement model. We will look at that. Don't worry at this jargon. We'll look at that in our next slides. So it requires the entry-level nurse to make multiple clinical decisions throughout the spectrum of the clinical judgment model. Again, don't worry, we are going to look at the clinical judgment model so that you can understand what we are talking about. And it uses an action model approach by combining individual components in a structured format. We are going to look at that. But just know, on the next generation Nclex, we have standalone items and we have care studies. So what are the new items that have been introduced in the next generation Nclex? You can have matrix multiple choice. We are going to see what it looks like. There's an item called matrix multiple response. We are also going to see what is a matrix multiple response. There is a multiple response, select all that apply. So you're given 6 to 10 choices and you're going to select all that apply to the question as you respond to the question. Then there is multiple response. Select a specific number. You can be told select n, select 4, select 3. So n represents that specific number. Then we have multiple response, grouping. We have different groups, maybe systems, and you are able to select multiple items. Then we have drag and drop, what you normally call close. We are going to look at that. We have drag and drop rationale. We have drop down close and drop down rationale. We are going to look at that. Then we have drop down table. There is highlight, whereby you highlight either the text on a phrase or a sentence or a paragraph, and you can also highlight on the table. So those are the new item types. What are standalone item types? Standalone item types on the next generation Nclex, we have bowtie, and this incorporates all 6 functions of clinical judgment in one item. But mainly we are going to see 3 clinical judgment elements are being tested on the bowtie. We are going to look at that as we progress. Then we have the trend. The trend may use one of the NGN item types, and this may include data that trend over the time, and it targets one or more 6 layer 3 clinical judgment functions. We are going to look at those clinical judgment functions or elements. It targets one or more of those 6 clinical judgment functions. But the most important thing about trend is about time. The data, the information is coming over time. Let's say 10 a.m. this and this happened, the patient was admitted with this and this, then at 10:30 this developed, at 11 a.m. this is what happened, at 12. So that is the trend question. Let's now look at those examples of those. We will start with drag and drop rationale. So drag words from the choices below to fill in each blank in the sentence. So you may have seen this kind of question where you read the client is at risk of developing dash, dash, and dash. So from the word choices there, you drag and drop on those dashes so that you can be able to make a response to the question. So another example of drag and drop clause is you drag one condition and one client finding in each blank of the following sentence. So look at it. The client is at risk of developing dash due to dash. So you have one side the condition, and the other side you have choices for the client findings. So you can read there infection, contractures, dysarrhythmias, pleural effusion, wound dehiscence, and that is now for the condition. You drag and drop. So the client is at risk of developing dash, maybe you could say infection, due to, then you look at the client finding table and you're going to see bed rest, chest tube placement, wound appropriation, respiratory assessment findings, purulent discharge from incision site. So I could say the client is at risk of developing infection due to purulent discharge from the inspection site. So that is how you answer an example of drag and drop clause. You choose and then drag and drop onto those boxes. Then we have matrix multiple response, an example of matrix multiple response, whereby you are given those check boxes and you're going to tick one or more. So like assessment finding for the appetite, you're going to tick for those 3 conditions. Is it present in bowel obstruction? If it is present, you tick. Appendicitis, is it affecting the appetite? You tick. Ruptured spleen, you tick. So you need to have good knowledge of these 3 conditions and their assessment findings to be able to tick. And I have told you, you can tick one or more check boxes for the different conditions or across those different conditions you're looking at there. That's a matrix multiple response example. Well, how about matrix multiple choice example? And this one is mostly used when evaluating an outcome. You want to find out whether the situation has become better, whether the situation has worsened, or it has remained the same. So you can say the assessment findings, you can have vitals such as respiratory rate, the blood pressure, pale skin tone, pulse oximetry reading, and then you find you need to look at the question and you find data telling you whether the situation has improved. If it has improved, you have to compare with something else. You have to compare with prior data or information. If the situation has improved, you tick the checkbox. No change, you tick. And here, decline, you tick. This is where now you evaluate the outcomes. We are going to look into that when we study the clinical judgment 6 elements. So an example of highlight item text. It is a hotspot. There is information highlighted using a different color. So here you find a question that will ask you click to highlight findings below that would indicate the client is not progressing as expected. So you need to read the progress notes and be able to see what is not expected, what is now abnormal, and highlight that. Then you can do the same on the table. You can highlight on the table, whereby you are asked to click to highlight below the findings that require immediate follow-up. This is now testing another clinical judgment element. The first one, recognizing cues. Don't worry, we are going to look into that, but I'm just preempting and telling you that each question type is testing something on the next generation Nclex exam. Then we have multiple response, select all that apply. And the nurse has been asked to prepare the patient for immediate surgery. Which of the following actions should the nurse take? Select all that apply. Here you can be given 6 to 10 choices or responses so that you can tick the correct answers on those check boxes. Then we can have examples of multiple response. Select n items. N includes specific number. You can be told select 4 findings, and those choices can be more than 4, so that you can only select 4, and the computer will not allow you to select more than 4. When you select 4, that's all. So that is another multiple response. Select n item. Then we have multiple response grouping. This presents information in a sentence format with 2 or 5 small groups of options. Each group contains 2 or 4 options with 1 to 4 correct answers. So you need to select 1 to all options in each group to answer the item. The number of correct answers in each group might not be the same. Examples of multiple response grouping is whereby you have, for each body system below, click to specify the potential nursing intervention that would be appropriate for the care of the client. Each body system may support more than one potential nursing intervention. So you can see on one side you have the body system, on the other side you have the potential nursing intervention. So you need to look at the body system, you look at the choices that you have been given, and you check on those check boxes the correct answers. You can check 1, 2 or more. You proceed to the other body system and the other. So that is how a multiple response grouping type of question looks like. Now let us look at the drop down rationale. This presents information as single sentence containing 2 drop downs. We call them dyads, or 3 drop downs. We call them triad. That represent missing information in form of a word or short phrases. The candidates select the options from each drop down to complete the sentence. An example of a drop down rationale, you can read the question like, the client is at risk of developing. Then you have to click there, and there's a drop down menu where you select one condition. It's at risk of developing hypoxia, stroke, dysarrhythmia, pulmonary embolism, as evidenced by. Then there's another drop down menu where you select as evidenced by the vital signs, neurological assessment, respiratory assessment, cardiovascular assessment. Then you have to select. So that is a drop down rationale. Then a drop down table, again, you can have like body systems that, like we said earlier, where you have neurological, respiratory, cardiovascular. And here, instead of checking, you're going to click on the findings, and there will be a drop down menu whereby you select from the list of findings that have been provided to answer that question. So for each body system, click to specify the potential nursing intervention that would be appropriate for the care of the client. Each body system may support more than one potential nursing intervention. And here you select from the drop-down menu, and now you provide the correct response. We are still on the next generation Nclex, and we are now starting to see what role these new item types play on the Nclex and how important they are. These next generation Nclex improves the critical thinking. You are required to demonstrate your critical thinking abilities and clinical decision making, because that is what will help you accomplish most of the tasks in your hospital environment. Then clinical judgment is very important. We said we want a safe entry level nurse. Nclex is about patient safety and public protection. So this exam is about measurement of all those skills. So clinical judgment, we have said, even at the entry level, is critical to patient safety and public protection. NGN focuses on the knowledge, skills, and abilities to provide safe and effective care during the first year of nursing, and that is very important. What is this clinical judgment we are talking about? The next generation Nclex focuses on clinical judgment, which is the ability to use knowledge, skills, and abilities to make decisions about patient care. The Nclex focuses on clinical judgment, and we said earlier 24% of what you are going to find on the Nclex is about clinical judgment. And this is the ability to use knowledge, skills, and abilities to make decisions about patient care. NCSBN defines clinical judgment as observed outcome of critical thinking. Observed outcome of critical thinking and decision making. It is an interactive process that uses knowledge to observe and assess cues, identify and prioritize concerns, generate the best possible evidence-based solution for safe care delivery. We said that clinical judgment skills help nurses accomplish majority of tasks required to provide safe and effective care to the patients. Think of a nurse who is required to possess so many skills, over 60 skills, and one clinical judgment skill is required to help accomplish about half of those tasks that a nurse is required to do. Clinical judgment is required in up to 46% of all the tasks that are performed by the entry-level nurses. That's quite a huge number, 46%. You only need one skill, clinical judgment. That's how important clinical judgment is on the Nclex, and you need to take note of that. The Nclex has 8 client needs categories, and now you need to think of clinical judgment as the 9th client need category. That's how important it is. It's a component that comprises of 24% of the Nclex. It is structured very well, and we have clinical judgment item types to measure specific skills that we are going to talk about as we progress. So which are these elements of the clinical judgment? We have come there now. The number one element is recognizing cues. And this is the client information, focused assessment, medication, lab values, and even diagnostic tests. You need to look at them and recognize cues. That is the first element. That is the first skill of the clinical judgment. The second one is analyzing cues. This is where you identify what is expected and what is unexpected findings. You identify potential complications and also identify data of immediate concern. You analyze cues. Then, from there, the third element of clinical judgment is prioritize hypothesis. Here you organize assessment data according to client changes and trends. Then you prioritize client problems or needs. Then the fourth element is generate solutions. Here you collaborate with the client or even the care partner and interprofessional team to establish outcomes and the plan of care. You must be able to plan and generate solution. Then take actions. Remember the nursing process. This is now the implementation phase. You have to do something. What do I do? So perform nursing actions based on prioritized problems. Then you accurately document the data, the client care data. Then monitor client's response to those interventions. That is the fifth element of the clinical judgment. The last and the sixth element is evaluating the outcomes. Here you reassess the client condition to determine achievement of expected outcomes and modify those outcomes or nursing actions based on client's response. So this is where now you look at the data and find out whether things have become better, whether things have worsened, or even whether they have remained the same. So let us look at the clinical judgment measurement model. I told you we are coming here. Clinical judgment measurement model. So the clinical judgment question types measure one or a couple of or all of the following 6 things. So let us look at them. The first one we have said is recognizing cues. The second one, analyzing cues. The third one, prioritizing hypotheses. The fourth one, generate solutions. Fifth, take action. And sixth, evaluating outcomes. So case studies have these 6 questions that always test these skills in exact order. Remember, everyone taking next generation Nclex will have 3 case studies, and each case study will have 6 questions. So that is a maximum of 18 questions. That's for everyone. Whether you took only 85 questions or you went all the way to the maximum length of 150 questions. So everyone must get these 18 items, these 3 case studies with 6 items each. Now, something important. This one I didn't know before, and I only came to know after the exam. I wouldn't want you to experience that these 6 questions on the case study test these skills, that is recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. These 6 are tested in the exact order. What do I mean? Question 1 will be testing on recognizing cue. Question 2 will be testing on analyzing cue. Question 3, prioritizing hypothesis. Question 4, generating solution. Question 5, taking action. And question 6 will be testing on evaluating outcomes in that exact order. That is important, and we are going to look at those examples as we continue. The question types that are used to measure clinical judgment, I have said the case studies, and this is a real-world nursing scenario accompanied by multiple test questions. It targets all the 6 clinical judgment skills. We have said it targets all the 6 clinical judgment skills. Then we have standalone questions. Standalone questions, they are individual questions that are not part of the case studies. They target one or more clinical judgment skills. They are like the trends and the bow ties. We're going to look at that in our next slides. So let us now look at the NGN case study, next generation Nclex case studies. We have said only 3 case studies will be on the next generation examination, and all test candidates must answer 6 questions asked in these case studies, regardless of how many total questions they receive. We have already said that everyone must get these 6 questions and 3 case studies, meaning a total of 18 questions that will be scored on the Nclex. Something that you need to understand is about lab values on the case studies. Many people have expressed worries about the lab values that are provided on the case studies. Don't worry, because whenever an exam presents the numerical lab values, it will also present a reference rate. For example, you'll be told client X had HB of 9.1 grams per deciliter. Then on the other end, you will be given a reference rate for the male and for the female. So I'm not telling you not to know the normals, lab values, but it's also important not to worry about them so much, because the reference ranges will be provided on the Nclex. That is something good, right? Okay, the first question asks what matters most at this time. It can be in form of extended multiple response, what we normally call SATA, select all that apply. So what you're looking at there is a sample case study. We have case study screen showing which question you're answering, question 1 of the 6. It is showing you that the total number of questions you're going to answer are 6, but only question 1 is being displayed there, and the case study. From the case study, you can see the information about a 78-year-old female in the emergency department. So it is telling you where this patient is, and now the nurses note at what time you can read and be able to get information. Then there is a section for the question, and the first question: select 4 findings that require immediate follow-up. You're given a list of choices where you are expected to tick the correct answers on those check boxes. So select 4 findings. So the computer will not allow you to select more than 4. What question type is that? So if you have been following me, you'll be able to answer what question type is that. Write down there in the comment section. I'll be looking at it. And I know now that that one is quite easy for you. Let us look at nursing case study question 1. We are going to look at these case study questions one by one and see what they are testing. The first question of the case study always addresses the first clinical judgment skill, and this is recognizing cues. This is whereby you ask yourself, what matters most right now? What information is important? What information is relevant? What is of immediate concern? That is what you're answering on recognizing cues. So it comes in extended multiple response questions, what we normally call SATA, select all that apply. And here you're given 6 to 10 response options are provided for you to choose from, or for you to tick from those check boxes. So that is a NGN case study question 1. It will always test on recognizing cues, the first clinical judgment skill. This is whereby you ask yourself, what matters most right now? What information is important? What information is relevant? What is of immediate concern? That is what you're answering on recognizing cues. So it comes in extended multiple response questions, what we normally call SATA, select all that apply. And here you're given 6 to 10 response options are provided for you to choose from, or for you to tick from those check boxes. So that is a NGN case study question 1. It will always test on recognizing cues, the first clinical judgment skill. Let's look at an example. As you can see, here you are looking at an example of next generation case study question 1. Select 4 findings that require immediate follow-up. Vital signs, lung sounds, capillary refill, client orientation, radio pass characteristics of the cough. So you're going to read the information provided in the case study, and now from that information you are able to recognize cues. You're able to know what is most important, what matters most, and then that will help you to answer that question. So now let us look at the next question on next generation Nclex case study. And this is question 2. Question 2 always addresses the second clinical judgment skill, which is analyzing cue. Analyzing cues, you ask yourself, why does that matter most? What client conditions are consistent with those cues that you recognized? Why is a particular cue of concern? And now here you consider multiple things that could be happening. So question 2 is always asking you to narrow things down. You have a lot of clues, and now you have to narrow things down. What you're looking at there is an example of a question from the case study. You are being asked to analyze those cues. So for each client finding below, click to specify if the finding is consistent with the disease process of pneumonia, a urinary tract infection, influenza. Each finding may support more than one disease process. So here you are given data. The patient has fever, the patient has confusion, the patient has body soreness, cough and sputum, the client has shortness of breath. So from those findings, you are being asked to narrow down. So you're given 3 conditions: pneumonia, UTI, and influenza, and for each check boxes you need to tick. Fever can be in pneumonia. Is it found in UTI? And is it in influenza? If it is in all those boxes, you are required to tick all of them. If it is only in pneumonia and UTI, you tick pneumonia and UTI and leave influenza. That is how you are trying to look at that data and analyzing, and that will help you answer. Each column must have at least one option response selected. You cannot leave a column without being selected. So each column must have at least one response option selected. So that is an example of question 2, which is testing you on the second clinical judgment skill, analyzing Q. Now let us look at next generation Nclex case study question 3. The third question of the case study always addresses the third clinical judgment skill, which is prioritizing hypothesis. So here you ask yourself, which explanations are most likely? What possible explanations are most serious? We are prioritizing some aspects of client's status. The question focuses on ranking potential issues, most likely experiencing X as evidenced by Y. So here you are narrowing down. Question 2, you are analyzing. Patient could be having pneumonia, patient could be having UTI, patient could be having influenza. You have all these clues. But in question 3, that is where now you narrow down. You say, you prioritize a certain hypothesis. You say the patient is experiencing X because of Y. So let us now look at the example of NGN case study question 3. Here you are told to complete the following sentence by choosing from the list of options. The client is at highest risk of developing. So you prioritize that. This type of question is a drop down. I was going to ask you to write on the comment box, but I told you anyway, it's a drop down type of question. So you select there, you select from the drop down menu. As evidenced by the clients, again you select. So from the question, you can see down there, the drop down menu. The client is at highest risk of developing. You can choose stroke, hypoxia, dysarrhythmia, pulmonary embolism. As evidenced by the clients, is it the vital signs, neurological assessment, respiratory assessment, cardiovascular assessment? So you can, your question will look like this. So your response will look like this. The client is at highest risk of developing stroke as evidenced by client's neurological assessment or cardiovascular assessment. So you need now to prioritize the hypothesis. That is question 3. And that is the first half of the NGN case study. The first half of case study, that is the first 3 questions, help you figure out what is going on with this patient. Where do I start? It gives you a lot of clues, a lot of information. And now you have recognized those cues, you have analyzed those cues, and you have prioritized the hypothesis. So here you are thinking of a nurse like a detective, and you have multiple of clues that will help you figure out what is going on and where do you start. What matters most right now, and what does this mean? What might be going on? Where do I start? So you have multiple of clues. It's like being a detective, and you want to find out what could be going on. From all those multiple clues that you have, you are narrowing down. You are recognizing the cues, analyzing the cues. Now you have prioritized hypothesis. That is the first half of the case study in the next generation Nclex. So in the next half of the case study, you could have an updated scenario. An updated scenario is where you have more information added onto the case study so that you can be able to know the progress of this patient and help you answer the rest of the questions. For example, in the first scenario, we didn't have information from 12. We only had information from 10. Now we have additional data from 12. And that is important because you need to understand what is going on with this patient, what has been done, and what you are going to do. Next generation case study question 4. It will always address clinical judgment number 4. Clinical judgment skill number 4, which is generate solution. Here you ask yourself, what could help? What is the possible explanation that are most serious? What are the desirable outcomes? What are the potential solutions to this problem? So the question can be structured in a matrix response form. That is where you have different columns with checkboxes, and for a particular row, you can check one or more answers. Let us look at the example. The nurse has reviewed nurse's note entries from 10 and 12 and is planning care for the client. For each potential nursing intervention, click to specify whether the intervention is indicated or contraindicated for the care of the client. So you have potential intervention, generate solution. There are things that have been listed there for you to choose from. You have to know whether that kind of intervention is indicated for this client. Remember, you prioritized hypothesis. Now you have to generate a solution. And now from your prioritized hypothesis, from your diagnosis, is it indicated? Is it contraindicated? That is very important. For example, prepare the client for defibrillation. Is it indicated? You tick on the checkbox. Is it contraindicated? You tick on the checkbox. From the knowledge, skills, and abilities, you are going now to make a decision here on this kind of a question. And that is what is going to help you pass the Nclex. Decision making on clinical judgment. You're going to look at it and generate a solution. You are reading potential intervention and generating a solution. NGN case study question 5. The 5th question of the case study always addresses the 5th clinical skill. And the 5th clinical skill here is take action. What do I do? What is the most appropriate thing to do? How do I do it? The question can be in form of extended multiple response, or what you call SATA, select all that apply. Questions should include action verbs. That is very important. You need to choose responses that look like this. Assess, blah, blah, blah. Ask the client, obtain, consent. Those are action verbs. Assess, ask, obtain, perform, mark the site for the surgery, administer this medication, provide this information. Those are action verbs. They are found in the question 5 of the next generation Nclex case study question 5. Let us look at the example. From there, you can see it can even be in a form of highlighting. It's a question type. The nurse has reviewed the orders from 12:15. Click to highlight below the 3 orders that nurse should perform right away. So what are you going to do? Insert. Insert is an action verb. Insert an indwelling catheter. Administer vancomycin 1 gram IV every 12 hours. Perform computed tomography CT scan. Give sodium chloride, normal saline. Perform laboratory test, that is the blood culture and sensitivity. So from those orders given there, you need to click 3 orders that the nurse should perform immediately, right away. So you highlight there, and that shows that you are taking the action. Clinical judgment number 5. Clinical judgment skill number 5. Next generation case study question 6. The last question of the case study is question 6, and this always addresses the 6th clinical judgment skill. Evaluate outcomes. So this is where you ask yourself, how did it go? You figure out what things got better, what things got worse, and which things remained the same. What improved, what declined, and what did not change. So the question can include highlighting. This is where you indicate a response by clicking on part of the sentence or part of the phrase, and it lights up in a different color. So let us look at an example of evaluating outcomes. It can also be in a matrix kind of form. For each assessment finding, click to specify if the findings indicate client's condition has improved, not changed, or has declined. That is evaluating the outcomes. If it is the respiratory rate, there will be data which you compare with. Right now it is at that 6, maybe it was at 50. So has that improved? You tick, yes, that is an improvement in a respiratory rate. The BP probably was 180 over 120. After intervention, the BP has gone down to 18 or 68. Is that an improvement? Yes, you tick improvement. The skin was pale in the beginning. The tone of the skin was pale. Up to now, it is still pale. Has that changed, or is that an improvement? Has the situation declined or has remained the same? If there is no change, you tick no change on the checkbox on the column of no change. If the pulse oximetry was at 91% and now it is at 88%, what is that? A decline. You tick on the decline column. That is an example of next generation Nclex question number 6, where it is testing you to evaluate the outcomes. You have other ways to measure clinical judgment, that is in form of trend question types, bow-tie question types, and other individual question types. So we are going to look at a sample trend question. This looks like a case study, but has only one question which targets one or more clinical judgment skills. It has information that changes over time. That is very important. It is testing you on one or more clinical judgment skills, and it has information that changes over time. An example of a trend question looks like this. The nurse in the emergency department is caring for a 10-year-old client who is experiencing projectile vomiting after drinking formula. So you have a flow sheet that is showing intake and output at 10 and at 2 p.m. and at 6 p.m. So you also have nurse's notes at 10 a.m., 2 p.m. and 6 p.m. You need to analyze that information to be able to answer the question. The question reads, the nurse is preparing to speak with the physician about the client's plan of care. Which of the following diagnostic procedures should the nurse anticipate the physician would order? Select all that apply. So you're going to tick on those check boxes to be able to answer the questions from that data. Remember, this is not a case study. So you hear many people saying that I got so many case studies in the exam. No. You need to know a case study has 6 questions, but a trend type of question has only one question and information that is changing over time. Let us now look at the sample bow-tie question. This is another way to measure clinical judgment skill. So you need to read information, drag and drop 2 actions to take, 1 condition most likely experiencing, and 2 parameters to monitor. So here, this is what we call a 2-1-2 situation. 2 actions to take, 1 condition experiencing, and 2 parameters to monitor. So the responses that you drag from, it's a drag and drop type of question. So the responses that you drag from are 5 actions to take. From the 5 actions to take, you only select 2. Then you have 4 conditions. You are given 4 conditions, you will only select 1 condition. And you have 5 parameters to monitor, you'll select 2 parameters. So it is always 5, 4, 5. 5 actions to take, 4 conditions, 5 parameters. So a bow-tie question has these elements: 2, 1, 2, 5, 4, 5. So for the test takers, They are mainly being tested on 3 clinical judgment skills. You could say that a board question tests all the 6 clinical judgment skills, but directly it only tests these 3 clinical judgment skills. And that is clinical judgment skill number 3, which is prioritizing hypothesis, clinical judgment skill number 5, which is taking action, and clinical judgment skill number 6, which is evaluating outcomes. And why am I saying this? When you are told 2 actions to take, that is taking action, clinical judgment skill number 5. When you are told 1 condition most likely experiencing, you are given 4 conditions, and here you are required to choose only 1 condition. What are you doing? You are prioritizing hypothesis, and this is clinical judgment skill number 3. Then parameters to monitor. This is more of evaluating outcomes, clinical judgment skill number 6. So when you look at about questions, you are mainly being tested directly on these 3 clinical judgment skill 3, skill 5, and skill 6. Let us now look what a bow-tie type of question looks like. Complete the diagram by selecting from the choices below to specify which potential condition of the client is most likely experiencing, 2 actions the nurse takes to address that condition, 2 parameters the nurse monitors to assess client's progress. And it looks like a bow tie that is placed here. When you wear that suit and nice shirt. On the middle, we have potential condition. That is where now you choose from the 4 responses and you choose only 1 condition. You will read the actions to take. There are 5. They are normally 5, and you have to choose 2. Then you have parameters to monitor. You read the parameters to monitor. There are 5, and you have to choose 2. That is the type of bow tie question, and it is testing clinical judgment. Again, now let us look what does the test look like. How is next generation Nclex different from the old Nclex? This is an overview of test design similarities and differences between the old Nclex and the current NGN Nclex. So look at it. The information is provided in 3 columns: the design specification, the old Nclex, and the next generation Nclex. So very first, we are going to look at what you need to know. The time allowed for the old Nclex was 5 hours, and even now it is still 5 hours. The delivery method, it's a variable length computer adaptive test. Even this Nclex, this next generation Nclex, is a variable length computer adaptive test. We are going to show you a video to watch and understand what is a computer adaptive test and how does it work. A pass-fail decision rules. In the old Nclex, we have CI, we have root, and also the maximum items. It is still the same in the next generation Nclex exam. The total exam length, the minimum type of questions and the maximum type of questions. In the old Nclex, you had a minimum of 75 and a maximum of 145. On the next generation Nclex, you have 85 to 150 questions. NSBN clinical judgment measurement model case studies. In the old Nclex, we didn't have case studies. This is what we are saying. Everybody must write 3 case studies, regardless of whether you have taken the minimum number of questions or the maximum number of questions. So here in the next generation Nclex, we have 3 case studies with 18 items. Standalone items in the old Nclex, they were 60 to 30 to 130. And on the next generation Nclex, you have 52 to 117. So the total scored items in the old Nclex was 60 to 130, and scored pre-test items. These ones are in the exam, but they are not scored. So you could have more than 3 case studies, but only the 3 will be scored. The others are not scored, so don't worry about them. The total scored items in the old Nclex, 60 to 130, and the total in the next generation Nclex is 70 to 135. If your question shut down at 85, you have done 70 total scored items plus 15 unscored, and that will bring you to 85. For those who sit for the Nclex and you do all the 150 questions, you will have done 135 items that will be scored for your Nclex, and 15 of them will not be scored. And everybody must get these 15 questions, regardless of the length. So if you took the minimum, it is 70 plus 15 and 80, and that is 85. So what does the test look like? The questions within the case study are not computer adaptive. All other questions are computer adaptive, meaning the computer will adapt to your skills. If everybody will start with an intermediate question, a medium difficulty type of question, and then when you pass that question, you'll be given a harder question. When you fail that question, you will get an easy question, and the computer will try to adapt with your skills. So this kind of adaptation keeps changing throughout the whole exam. But for the case study question, they are static. They are not computer adaptive. That one you must know. Then the other thing, we have the unscored 15 items. These unscored 15 items, they include case studies and other clinical judgment questions. And these are for the purpose of research. So you don't need to mind about the number of questions. You may not be even aware of what you're answering, whether it is scored or unscored, but just know that these 15 items, they may be in form of case studies. So you might get, you could get even 7 case studies, but only 3 will be scored. The other 4 will not be scored. So don't worry about that. These ones, we have 15 items that are unscored. About 10% of standalone questions are testing clinical judgment elements, and we have seen them: recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. 10% of standalone questions, these are the bow tie and the thread questions, they test clinical judgment skills. And only 3 case studies count. That is very important. So when you get 7 case studies, only 3 will count. Okay? How does scoring of the next generation Nclex look like? We have partial credit. In the old Nclex, we didn't have a situation where you could get marks for getting part of the question correct and failing the other part. But in the new next generation Nclex, we have partial credit for the responses given. Then we have 3 different scoring methods. We have 0 or 1 scoring. The second one is plus or minus scoring, and the third one is rational scoring. We are going to look at each one of them from different question types that can be provided on the Nclex. The following chart describes the 3 different next generation Nclex scoring models. The 0-1 scoring, you earn 1 point for endorsing each correct response, and earn 0 points for endorsing each incorrect response. So the total score for a multi-point item is the sum of all correct responses. So we are not going to count the incorrect responses. You only count what is correct, and that is what you get. So for example, if you are told to indicate 4 findings, then you indicate 3 that are correct and 1 which is incorrect. The total points there are 3 because we only focus on the correct responses. The other scoring method is positive or negative scoring. So you earn 1 point for endorsing each correct response, then subtract 1 point for endorsing each incorrect response. So a total score for a multi-point item is the sum of all the positive and negative points. So negative total scores are truncated as 0. For example, if you are given a question and let's say I select all that apply type of question, and then you select 4 that are correct and 2 that are incorrect, the total score will be 4 minus 2. So let's look at another example. You are given a select all that apply type of question, then you select two that are correct and 4 that are incorrect. you'll find that 2 minus 4 is -2. On this next generation Nclex, we don't give negative points, so that will be truncated as 0. For that question, you get 0, not -2. That is very important to understand for this next generation Nclex. The other method for scoring is the rational scoring. You earn a point when both responses in the pair are correct. For example, you can be told the patient is most likely experiencing X as evidenced by Y. So both X and Y must be correct for you to get it right for that kind of question. Even if you provide X as correct and Y as incorrect, you don't get any marks for that question. If you provide that X is incorrect and Y is incorrect, you still don't get marks for that kind of question. So you need to get both right. That is the rational scoring. We have to look at the example of 0-1 scoring. 0-1 scoring is a classic rule that traditionally has been used to score multiple choice question. Selecting the correct option, that is the key, results in earning a point. Selecting an incorrect option, that is a distractor, results in a score of 0. This rule is applied to all single response items. You need to see the example of multiple choice item here. Which of the following actions should the nurse take? 1. Prepare the client for chest x-ray. Administer intravenous fluids to the client. Request a prescription for acetaminophen. Then place a nasal cannula for the client for oxygen administration. That is the correct answer. So you get 1 point for the correct answer. And if you indicated your answer as administer intravenous fluids, which is incorrect, you get 0. It is either 0 or 1 point. So 0-1 scoring rule is also applied in multiple point of items, and for these items, the total score of the item is the sum of the correct options. The following are examples of 0-1 scoring rule for multiple point items. And you can see from the matrix multiple choice, for this item type, each row is scored independently with the 0-1 scoring, and the scores for the rows are summed together to get the total score of the item, as each row is scored with a 0 or a 1. The maximum score is the total number of rows provided. The following is an example with a maximum score of 5 points, as there are 5 rows. Each row, if it is respiratory, has the condition improved? Yes, that is 1 point. Has the BP improved? If you said it improved and that was incorrect, you get 0 point because it is incorrect. Then the BP, has it declined? Yes, and it is correct. You get 1 point. So in the example of matrix multiple choice question, the candidate has answered row 1 and row 3 and row 4 and 5 correctly, which results in 4 points. The candidate answered row 2 incorrectly, which resulted in a score of 0. So overall, this response pattern results in an item score of 4 points because it is the sum of correct options. No penalty is implemented for selecting any distractors. There will be no penalties for the incorrect choice. So you get 4, that is 4. Then you have multiple choice, select n. N is the number whereby you are supposed to select, let's say, 4 findings that require immediate follow-up. So you have vital signs, lung sounds, capillary refill, client orientation, radio pass characteristics, and characteristics of the cough. You are supposed to select 4 findings. So suppose you select 3 that are correct and 1 that is incorrect. So your total score is just 3. We focus on the correct options only. That is 0-1 scoring method. Then in drop down clause, you can see how the 0-1 method works. If you answer 2 correct and 1 incorrect, then you get 2 points. Then we have the drop down table. You can see if you answer 2 correct and 1 incorrect, still you have 2 points. That is 0, 1 scoring in different question types on the Nclex, on the next generation Nclex exam. The 0-1 scoring also applies in bowtie, whereby, for example, you have two actions to take, one condition most likely experiencing, and parameters on the other end to monitor. If you, let's say you got two actions to take correct, and the condition most likely experiencing correct, so far you have 3 points. And then on the side of parameters to monitor, you only get one correct, so out of the possible two. So of the 5 items, you get 4 correct. So you get 4 total points, and here we focus on the correct responses that you have provided. So you get 4 out of 5. That is still 0-1 scoring. Let us now look at the positive or negative scoring. The positive negative scoring rule was inspired by the signal detection theory. It provides a good measure of a candidate's ability to identify relevant information in the presence of distractors, and has been found to be useful and valid scoring model. Points are earned by identifying and selecting correct options. And by contrast, points are subtracted when incorrect options are selected. This method is applied to multi-point items where candidates are free to select as many or few options that apply for the item. For example, select all that apply type of questions, multiple response items type of questions. The total score of the item is the sum of the correct options endorsed minus the sum of incorrect options endorsed by the candidate. All negative total scores are rounded up to 0. If we take your positive minus your negative, then if you have negative score, it's rounded up to 0. We have already said that. Our example shows the candidate selected all 3 keys and 1 distractor. Therefore, the score for this item is +3 of the keys and -1 of the distractor. So the resulting final score is only 2 points. So here it is very important to understand that you only choose what you know is correct. Because when you go ahead and start guessing what is incorrect, it might end up giving you a 0 point on the exam. If you only know that 2 points are correct, just choose those 2 points. When you end up choosing other 2 points that are incorrect, the total score will be 2 minus 2, which is 0. So you end up getting 0 even when you had 2 points that are correct. That is a very huge tip for you as you prepare for the Nclex. Make decisions that are going to give you only the correct options that you know. If you don't know, just leave it, because an incorrect option that has a negative score and it will affect what you ticked as correct. In matrix multiple response question, again you can see positive negative marking. Maybe you tick 3 correct options and 2 incorrect responses. 3 minus 2, you only get 1 point. Again, in matrix grouping, for each row we are going to see the correct options that you are able to tick, and if you ticked an incorrect option, we will subtract 2 minus 1 and you only end up with 1 point. Now let us look at the last scoring method, which is called rational scoring. The rational scoring rule is applied to items assessing paired information, concepts that require justification through a rationale. For example, a nurse must perform action X because of Y. To demonstrate a full understanding of the concept, correct options for both pieces of the paired information must be selected to receive a point. So if any incorrect option is selected, then a score of 0 is obtained. So below is an example of 3 possible response patterns and their corresponding scores. In the first example, the client is at high risk of developing X as evidenced by the client's Y. So you must give correct options for both pieces to get a point. Then if you got the first one correct and the second one incorrect, still 0 point. Just like the same for the person who got both incorrect. So you must get both correct to earn a point. I hope that is clear. Let us now look at the computer adaptive testing. The Nclex uses computer adaptive testing, and that is where I told you the computer tries to adapt to your skills. Everyone must start with a medium question, and then when you get that correct, the computer will try to give you a harder question or an easier question if you didn't get it correct. It will try to adapt to your level until it is 95% certain whether you are above the passing standard or below the passing standard. We are also going to look at that, but that is basically the computer adaptive test. If you are planning to take the Nclex test, then you need to know about computer adaptive test. I'm going to help you understand why Nclex use computer adaptive test. The purpose of any test is to measure knowledge and a set of abilities or skills. Think of nursing knowledge, skills, and abilities as traits that can range from low ability to high ability. Let's label that range from -3 to 3 on a scale. Computer adaptive testing adapts the questions you see based on your previous answers. The test begins with a question of medium difficulty, which will be put at 0 on your -3 to 3 scale. The candidate can either get this question right or wrong. Suppose the candidate gets it correctly, then the cutout algorithm places the student's estimate ability greater than 0, but places a lot of uncertainty around the estimate ability because there has only been one question. On a scale, we might show this as a dot around 0.5 to mark our estimate ability, but a very wide range of uncertainty. The key to computer adaptive test is what happens next. Instead of getting a random question, the computer now selects the question around the candidate's ability estimate. If the candidate answers correctly, the estimate ability moves forward because they got a harder question right. But also, the wide uncertainty range has also shrunk because there is more confidence in estimate ability now after answering 2 questions than when we only answered 1 question. Remember, on a computer adaptive test, estimate ability can change with each new question. When the candidate correctly answers the question, their estimate ability goes up and they see a more difficult question. When the estimate ability is incorrectly answered, when the candidate incorrectly answers the question, the estimate ability goes down towards the negative side of the scale and they see a less difficult question. As the candidate responds to more and more questions, the uncertainty continues to shrink and estimate ability becomes more precise. This continues until the computer is 95% certain that you are above or below the passing standard, and that's when you get a pass or a fail. 85 questions is the earliest a pass result can be determined. This is called a minimum length pass. When you fail at 85 questions, this is called a minimum length fail. If at 85 questions the computer has not yet determined with 95% certainty your estimate ability, it will continue administering questions all the way even up to 150 questions. By this time, the uncertainty will shrink to nearly 0 and ability estimate will be precise enough to determine the results. Sometimes the terms maximum length pass or maximum length fail are used. An ability estimate above the passing standard results is called a pass, and an ability estimate below the passing standard results is known as fail. That is computer adaptive test that is used on the Nclex exam. So the last item is pass or fail decision rules. Pass, did I pass or did I fail? So how does the computer decide whether you have passed or failed the Nclex? it will use one of these three rules. The number one rule is the 95 confidence interval rule, and this rule is the most common for Nclex candidates. The computer will stop administering items when it is 95% certain that the candidate's ability is clearly above or clearly below the passing standard. So when the computer is 95% certain that you are clearly above the passing standard or below the passing standard, that is when it will stop administering items or questions. That is a 95% confidence interval rule. It's the most common. Then there is the maximum rank exam rule. Some candidates' ability levels will be very close to the passing standard. So when this is the case, the computer continues to administer questions until maximum number of questions is reached. So at this point, the computer disregards the 95% confidence interval rule and considers only the final ability estimate based on the responses to all items in the exam. All the 150 items. It will look at them and give you the score. So if the final ability estimate is at or above the passing standard, the candidate will pass. And if the final ability estimate is below the passing standard, the candidate will fail. So that is the maximum exam rule. Then there is another rule called ROUT, run out of time. Run out of time rule. If a candidate runs out of time before reaching the maximum number of items, remember here minimum is 85, maximum is 150, and you only have 5 hours to take that test. If after 5 hours you have not reached the maximum number of items, the computer has not determined with 95% certainty whether the candidate has passed or failed, an alternate criteria is used. So if the candidate has not answered the minimum number of required items, remember in NGN the minimum number of questions is 85. If you have not answered 85 questions and you have run out of time, you automatically fail the Nclex. If the candidate has not answered the minimum number of required items and the minimum number of required items, the candidate automatically fails. If at least minimum number of required items were answered, maybe you answered slightly above 85, you went all the way to 100, 120. The final ability estimate will be based on all those responses that were given before the exam time expired. So if you are able to answer 128 questions, the final ability estimate will be based on those 128 questions. And if the score is at or above the passing standard, that is when the candidate will be considered as having passed the exam. But if it is below the passing standard for those 128 questions, then that's a fail. So that is how scoring is done. Many people didn't know how it is done on the Nclex. We have the 95% confidence interval rule, we have the maximum length exam rule, and the run out of time rule. We have come to the end of our topic. It was a long topic, but I hope that it has helped you understand what is on the next generation Nclex exam. And now you're going to confidently prepare for the exam. We have noticed that clinical judgment aspect or clinical judgment skills are most important for this Nclex exam, especially for the novice nurses or entry-level nurses who are practicing for the first 12 months. clinical judgment is very critical, and that is why a lot of emphasis is placed on it on the Nclex exam. So thank you so much for being with us throughout the whole session. And if there is anyone here who is watching us for the first time, kindly subscribe to our YouTube channel, leave a like and a comment, and also share this video to other nurses who are preparing for the Nclex or who are thinking about this Nclex exam, so that they can also benefit just like you. We wish you all the best. We are going to be with you throughout this journey, and you are going to make sure that you pass the Nclex within the very first attempt. So see you again in our next video. Thank you.